Thank you for joining us for this special webinar series highlighting the new 2014 research grants funded by the AKC Canine Health Foundation. In all, 17 grants were approved, totaling nearly $1.5 million for canine health research. These projects cover 10 unique areas of canine health. In each of the short videos in this series, CHF's Chief Scientific Officer, Dr. Shila Nordone, explains the proposed work, significance, and impact for each grant, and how these projects will work together to move canine health forward so that all dogs can live longer, healthier lives. We hope you find these webinars to be informative and exciting. Please visit www.akcchf.org/donate to show your support for our funded research. In this session, Shila will be discussing our new grants within the Gastrointestinal Disease Research Program area.
The Gastrointestinal Disease Research Program for the AKC Canine Health Foundation supports research into the pathophysiology of GI disease in the dog, molecular and genetic basis of disease, and identification of potential therapeutic drugs that will reduce the pathology associated with GI disease in the dog. One of the first grants that we funded in our GI disease research program is Grant 2002, Defining the Genetic Basis of Inflammatory Bowel Disease. The principal investigator is Dr. Karen Allenspach, and she's at the Royal Veterinary College in London, and we funded this grant for $119,268. Inflammatory bowel disease is a disease that's characterized by chronic and protracted diarrhea, malabsorption, weight loss, anemia, and malnutrition due to the malabsorption. This disease, IBD, is treatable, but it's seldom cured. Diagnosis is made through endoscopy and biopsy of the intestinal wall, or at times by exploratory surgery. The major goals of treatment right now, since it can't be cured, are to stabilize body weight, ameliorate the gastrointestinal symptoms, and reduce the immune system's response that is causing the inflammation within the gut of the dog. So most often, because this is an immune-mediated disease, dogs are treated with immunosuppressive drugs and antibiotics. So the deliverables of Dr. Allenspach's IBD study are to identify genetic markers known as SNPs, single nucleotide polymorphisms, that contribute to disease susceptibility. She already has some mechanism data showing that one putative mutation contributes to the inflammation seen in the intestine of dogs with IBD. She's going to use a GWAS study, a genome-wide association study, to identify the full breadth of underlying genetic factors that could contribute to IBD in the dog. She's going to enhance her statistical power by using a very common breed of dog, the German Shepherd dog. And even though she is starting with one breed, she expects to have transference of information across multiple breeds that suffer from inflammatory bowel disease. A second grant that we funded this year in our gastrointestinal disease research program is Grant 2050. You want to start over?
Yeah,
okay.
Just in case.
All right. The second grant that we funded this year in our gastrointestinal disease research program is 2050, Defining the Genetic Susceptibility to Granulomatous Colitis, a very severe form of inflammatory bowel disease. The principal investigator is Kenny Simpson at Cornell University, and we funded this grant for $187,730. So as I said, granulomatous colitis is a very severe form of inflammatory bowel disease, and in these patients we see colitis, bloody feces, weight loss, and this often progresses to a wasting syndrome in severe cases. There are deliverables, expected deliverables of the granulomatous colitis grant. This is a continuation of our previously funded grant, 1445. So Dr. Simpson does have a body of research in this area. And this was a very highly productive grant that resulted in identifiable heritable abnormalities that he believes likely confer susceptibility to invasion and persistence of a bacteria that's normally found in the GI tract of the dog called E. coli. He's identified the genes and causal variants in cellular pathways involved in the development of granulomatous colitis, and he expects to be able to use this information to develop screening tests to eradicate this disease and advance our understanding of the development of IBD in dogs and people. The work that we funded this year in IBD and granulomatous colitis will complement some existing research we have funded. Grant 1930, development of minimally invasive laparoscopic surgery as definitive diagnostic tool for gastrointestinal obstruction. And this is a grant that was awarded to Dr. Brad Case at University of Florida, and that total grant amount was $12,960.
For more information and to support these grants, please visit us online at www.akcchf.org/2014 grants.